on 531 VI.
It is 25 minutes past 7 o'clock for Tuesday, the 29th of July. William Reti in the chair with you through until 9 a.m. this morning. It's brilliant to have your company. Time now to get a pulse check on what's going on with our Pacific People's Minister, what he's been up to lately, and obviously to delve into all the political issues relevant to us at the moment. He joins us now. Very good morning to you, Minister.
Brenna, well, good to see you.
Likewise, it's great to have your company. Hey, look, I want to firstly just have a wee bit of a pulse check as to, I believe you attended the Pacific Islands Forum Economic Ministers meeting in Suva. Give me an understanding of what actually went down there.
So that's actually for the Secretariat to put out as outcome statement. So I can't talk outside of those discussions. But fundamentally, from around the Pacific, we came together to the mandate, and the mission was to prepare for PIF later in the year in Aotearoa, and also to look at some of the key issues affecting the Pacific, particularly around climate change resilience, economic funding into the Pacific. That was the mandate for the meeting. Well received, well turned out, and some good progress made towards further discussions when the leaders come together in Aotearoa in a few months' time.
Yeah, indeed. Okay, and look, let's get more specific in the sense of the government's announced a $4 million support package for Fiji's response to HIV outbreak. Could you perhaps talk me through the details of that?
Sure. So when I was in Fiji, I caught up with my friend and colleague, the Minister for Health from Fiji, and it had been explained to us long before we got there that, as you'll be aware, there are challenges in the Pacific around drugs, and Fiji has the same. And as a consequence of that, the HIV rates have increased. And so in collaboration with the Ministry for Foreign Affairs, we were able to announce a $4 million support package to Fiji to help with their HIV management. As the Minister explained to me, that was extremely well received. They were very grateful, and that will be used across a range of things. That will be used substantively for education, so in the primary care space.
Okay.
Some of it will be used for diagnosis, some of it for laboratory diagnosis, and they have some support from other avenues around the pharmaceutical management of HIV, but substantively our contribution will help them with that very important, some would say the most important component to HIV, that is the education component, which will have a close association with drug use through the Pacific.
And finally, just before we wrap up on this particular subject, I know, as you pointed out, you can't talk to the specifics of that meeting that you were at last week around the Pacific Islands Forum, but obviously with the major forum a wee bit later on this year, there's often been that criticism that these forums don't really amount to much. I mean, what can you give us a sense of, from last week, you feeling positive about the outcomes?
Sure, yes, I am, because this was a very action-orientated forum. So there was an underpinning strategy and clear objectives, and the outcome statements will reflect that. But it was very much now who does what towards this objective, what is the time frame. So it was very much an action-orientated forum rather than just general discussions.
Great. Oh, look, let's shift our attention now to a bit of a sore point, the Cook Islands-New Zealand relationship. Obviously, the Cooks celebrating its 60th constitution. With all of that in mind, would it have been appropriate for you to attend in your capacity as Pacific People's Minister?
Oh, I think if we look at that, first of all, we deeply value the relationship with the Cook Islands, and if we look at that, we have sent almost the most senior person in New Zealand, the Governor General, Dame Cindy Cairo, to that event as our representative. So a very, very senior, as I say, technically the most senior person in New Zealand, to New Zealand, and in keeping with what we sent to Niue when they had their 50th celebration as well. We asked Dame Cindy if she would represent us. So very pleased that she was able to accommodate that and will be our voice at that celebration.
Would it not have been appropriate, though, for someone from this government to attend the celebrations in the Cook Islands, given the very public situation that is unfolding between the New Zealand government and the Cooks?
Oh, I think the fact that we sent the most senior person in New Zealand to the Cook Islands for that celebration sends a signal of indeed how we value the relationship.
And sticking with that then, though, are you confident or are you happy with the way in which this is playing out very publicly in the media from your government and from, your own ministers?
Oh, look, we'll continue to have dialogue, constructive dialogue with our Pacific Island neighbours, including the Cooks, and we'll just continue to keep working along and finding those areas that work for both of us. So whether or not that gets carried into public domain, I guess that's for each of the respective partners to figure out. But together with officials and with trusted people, we'll keep working along that relationship to get a good outcome for all of us.
Ultimately, who's to blame here, though, from this actually spilling out into the media? It's unhelpful, some would argue, when this government's been very vocal about not being pleased with the way in which the Cook Islands is conducting itself.
Look, I'm not responsible for how the media chooses to take various issues out into public domain.
Yes.
As I said, our key point will be we'll keep talking, we'll keep being that trusted partner that we've always been, and we'll look to find the best way forward.
Indeed. Look, let's shift our attention back to New Zealand now. And I think this is a conversation well worth having, given your health background. Waikato University, of course, the med school situation there. Inevitably, it's raised questions around Pacific targeted medical pathways. Are you an advocate for that?
So that's a decision for Waikato Medical School and Waikato University to make, but what they have indicated is that as part of the selection process, even though they may not have targeted pathways or quotas per se, that the selection process will take into account those areas where we're underrepresented, underweighted, where we have vulnerable populations as part of that selection process. But they have indicated in this first instance that there won't be quotas per se.
Indeed, but I suppose the question I'm asking is, are you an advocate? Given your capacity as Pacific People's Minister, would you like to see Pacific targeted medical pathways? And especially given your very, very credible background in the health workforce.
So what I'd like to see is I'd like to see the graduates focused and directed as much as possible towards where we have need.
Sure.
And those areas we have need are general practice, rural environments, and then within those areas, of course, we have needs for Pacifica, we have needs for Māori, we have a range of other needs. I'd like to see the graduates encouraged, focused, and trained in those pathways so that that's where they eventually land when they graduate. That would be what I'd like to do. Align the supply, which we have, with the need that we have.
So not supporting perhaps, what some would argue would be a good thing to have Pacific quotas, etc. at these med schools.
Oh, that's a decision, operational decision for Waikato Medical School and Waikato University. I want to align the graduates we get with where we have the need out in society.
I just want to see, whether you advocate for it or not, Minister.
Well, whether I advocate for it or not is an issue for Waikato University. They have the penultimate decision making. What we've indicated to them through the business case and through other avenues is clearly we have a need in general practice. Clearly we have a need in rural environments, and then as categories of that, we have other needs as well. Can we train and encourage the graduates from this new medical school to go out and meet those needs?
Indeed. Look, let's shift our attention to the Vanuatu Bislama Language Week, and of course through your capacity as Minister, no doubt pleased about this?
Very pleased. So I was at Papamoa on Sunday at the national celebration and opening of Bislama Week. And that was just a wonderful event to be at. And as I said to the audience, we're making a bit of history here. This is the first time we've had Bislama Week, and everyone was very, very excited. We were also celebrating, I think it was 60 years of independence for Vanuatu, 1980. And so they were very, very excited. It might be 45 years actually. Very excited about that. And it was a wonderful event. There was traditional dress, a large number of RSC workers. So we were in the fruit picking area of Tauranga Papamoa, and so a number of employers and their RSC workers were there as well. And it was just delightful to be in that audience. And I was able to say to them, look, I've had the privilege of standing on the new wharf at Vanuatu on a diplomatic mission that I've had with Minister Peters. I've had the privilege of standing underneath the roof of the Women's Market and had the privilege of standing in the talking circle beside the Parliament. And so they were able to get a further sense of, he's actually been in our home. He's actually been in our place. He gets us. So it was just a wonderful event and very excited for them.
Very lovely indeed. Hey, look, just going to throw a question to you before we go. I mean, it's more merely just your pulse check, really. How do you think your government's going when it comes to the fight in the cost of living crisis? For example, the surcharge ban that the government announced. Are you guys really getting on top of it?
Oh, we're working really hard. When you look at how we've brought down inflation, which in turn has brought down mortgage interest rates, which will eventually, there is a tail when that happens, but that eventually flows through into people's pockets across a range of endeavours. We've really thrown a lot at the cost of living. And we have it as a key focus. We understand the pain and acknowledge the pain that comes with cost of living, but we are throwing every tool we have, and we're needing those actions to filter through into people's pockets so that they can feel the benefit of that.
Indeed. I look forward to having my extra 17 cents. Thank you very much, Minister. That is Minister Dr. Shane Reti, the Pacific People's Minister. Really appreciate your time as always.
E pai ana kia pai tō rā.
You're listening to